Hey, how's it going? My name is Tiaja. I'm with the Alameda Apprentice Doctor Program. Before I start, I just want to let you know a little bit of myself. I go to a California Distinguished School, ACLC. It's great. It's an awesome school. It's got great science programs, great math programs, and it just so happens two of my best friends, Aaron and Dylan, are the best math and science students in California. That's how I roll. Just recently this year, I've been attending a shadow doctor program at Highland Hospital called the Model Neighborhood Program. And then I was just recently accepted into Samuel Merritt University Youth Bridge Program under Griffith Jackson. Plus, on top of that, I have been accepted into Haas Business School at Cal Berkeley. So I got a lot of stuff on my plate. I'm going to be pretty busy. I'm going to say a little bit about my website that I mentioned earlier. You can also reach it at foryoungdoctors.org. Me and my sister, we do articles, videos. I just did an article on the cochlea, which I was describing how it helps for hearing and balance, how it sends sound waves to your neurons. Alright, so I'm just going to let you know some of the resources that I use. So one of the things I have right here is by Dr. Anton, Stitches and Wounds, which is a kit that pretty much lets you know how doctors use stitches to stitch up wounds. It's legit. It's pretty legit. They've got the real thing: scalpels, knives, scissors, string, you name it. They got the whole thing. It's pretty much the kit. Some of the things that came with it was right here is an otoscope, which for some of you who don't know is used for looking through the ear. I have a reflex hammer and a thermometer. Okay. Dr. Anton has also done some other things, like he's got this book right here called The Apprentice Doctor, which is pretty much what helped motivate me and my sister to make Alameda Apprentice Doctor. I've also read and listened to some audiobooks. The one that's most fresh in my mind right now is I listened to one called Medical Science. It was describing the history of Western medicine, and they were just telling stories about the history, and some of them were kind of funny. Like, they would put a puppy dog next to a sleeping infant to make, I don't know, a sore throat go away. This is like during the Renaissance age of medicine. They're just trying out everything. Some more of my resources would be, I have this VHS called The Human Body, just the facts. It consists of the muscular system, the nervous system, and major organs in the body. I also have another VHS called Body Atlas, which goes over glands and hormones. Another resource that I have, which is the main point of what I'm talking to you today about, is a program called Code Red. I have it open right here. I'll show you. It looks something like this. I'm just going to load game, save game. And basically what it does, it's a real-life simulator where they give you a patient, and it's up to you to figure out what's wrong with the patient. How do you fix what their ailment is, what their condition is. You gotta take their blood pressure, EKG, the works. So what I'm going to talk to you about right now is my just recent patient. Her name was Stacy Blum. She was 15 years old. She was female, of course. She was attending high school, moderately popular. Now I get the patient regimen, and they give me a brief history. So her brief history was she was brought to the ER because she had passed out at school. Friends also mentioned something about her not eating for 2 weeks. She was also, Leslie said something about they found a drug in her backpack that she'd been taking called Prozac, which is, for those of you who don't know, a painkiller, type of painkiller. Now, just thinking about this, without even using the resources the game gives you, I can assume, alright, let's put up the facts. Female, she's young, about 15. It's pretty popular, going to high school. She's not eating for 2 weeks. She's taking a painkiller.
Oh, that's right.
Maybe a nibble here, right there, but no food.
Silly.
With this, I can automatically assume that maybe she has abnormal fear of obesity, which is quite common in young women who attend high school or middle school. So I do the thing, do the patient. Let me look at my notes real quick. Okay, so I pretty much had to do the basics. I had to check her blood pressure, her temperature, what her heart rate was. It all checked out normal. The only problem was she was passed out. So of course I had to give her an oxygen mask, IV fluids, IV meds. Then after that, like pretty much after you solve that, you got to do the treatment regimen. Where to send her when you're done, or him. Where to send him when you're done. Transport orders. So, pretty much I'm just gonna say real quick. The only way you can really solve an issue like this, self-induced starvation or dehydration, would be through counseling, consulting with the parents, peers, and just self-imaging. If people would just stop caring so much about what they look like, what they see on TV or magazines, that you gotta be super skinny. You look perfectly fine the way you are. So after that, after you do that, the game will give you like an amount of score points that you gained. They time you for speed, how fast you were able to do it, because they don't want to take like 2 hours just to fix a splinter. And they also grade you on how many procedures you did correctly. On that, it's also out of 500 points, I got 492, which is actually pretty good. So on that would be my resources, the game I use, Code Red. Again, I want to be a surgeon, but I'm still deciding whether I want to be a surgeon or a general practitioner doctor. And this is my first video, and that's that.